I have these, three different style of implants.
Mm-hmm.
And how they vary is dependent on how the look will be. Every single implant has a different look.
Mm-hmm.
So I have one implant that's kind of the older generation mentor implant that gives patients a little bit more of a natural appearance.
Mm-hmm.
And then the newest generation is called the boost implant, and that's for patients that want to really, round upper pole fullness. It's relatively new. Patients are really liking it because once the implant settles in those type of implants, the gel, 86% of the gel stays in the upper pole, so there's more of a upper pole fullness. And I can show you right now the different styles of implants.
Okay.
So we talked about the profiles and the different style of implants and how the volume is different in the upper pole once it settles. But the other difference, it's also how the implant feels. Now these are both silicone gel implants, okay? But if you can see the difference here, is this implant here is the old generation, and you can see how it kind of collapses a little bit. And this one is the extra fill, and you can see how it's not a collapsed implant. Now in the body, under the muscle is going to push the implant down, and they're going to be kind of like this, okay? But the feel is really different with the extra fill. And if you feel it, there is a difference between the extra fill and the older generation. This is a little firmer, still soft and natural as this one, but it's a little bit firmer than this old generation. Here is the difference between the extra fill implant and the boost implant. Again, if you look, actually both the extra fill and the boost, they don't collapse, okay? So, but the boost is a little firmer, has a little bit more volume than the extra fill. And then the other thing you can notice as I put them on my breast, and these are too small for me, I would go bigger. But you can see that there's more fullness in this upper pole on the boost versus the extra fill.